and in reservoirs and repairs of leaks that would add redundancy to the system and restore normal service. The same is expected in the aviation industry. While a plane can fly on one engine, all commercial jets have 2 or even 4 engines to ensure there isn't a devastating failure. Somehow, however, we've learned to live without redundancy in our hospital capacities, such that when highly predictable seasonal demand occurs, the situation becomes exponentially problematic. According to the Organization for Economic Cooperation and Development, the average number of beds per capita is about 4.4 per 1,000, with a bed occupancy rate of 76%. The lowest rates across the world of Europe are in Sweden and the UK. The UK has 2.5 beds per 1,000, and last year, it had a bed occupancy rate above 93%. The impact of the lack of redundancy is clear, particularly during winter. People end up with lengthy waits in the emergency departments, ambulances stack up outside hospitals, and patients with planned surgery see those operations canceled. Virtual wards are one way to improve the situation. These provide hospital-level care to patients at home using some simple technology, often an app or a sensor with a few medical devices, which allow medical staff to remotely monitor the patient's clinical condition. Virtual wards allow patients admitted to the hospital to go home many days earlier and still get quality care in the comfort of their own home. We now have tech-enabled virtual wards in every part of England, available on the National Health Service. Even more ambitious is digital home care, which includes patients with an ongoing long-term condition that needs constant monitoring. This is important because 70% of hospital beds are occupied by someone who is there due to their long-term condition. In Airedale, they've managed to halve the rate of people with chronic obstructive pulmonary disease, a progressive lung disease, who have to come into hospital as an emergency admission. Imperial College in London achieved similar results for patients with heart failure. The next challenge is to move from a vibrant cottage industry of digital home care to our own industrial revolution. We are currently avoiding hospital admissions and helping people go home earlier. But to really scale, we need to recruit patients earlier than the point of admission. We now have smart population health data that can help us target people who would most benefit from tech-enabled care at home and can intervene earlier. Home testing has also become commonplace during the pandemic, and that's another tool that can be used in digital home care. For instance, lateral flows for neutropenic sepsis, a complication that occurs during oncology treatment, are in development, which could help anyone managing cancer from home. Over the next few years, digital home care needs to become mainstream, making our healthcare system less crisis-based and more predictable, resolving issues before they escalate. We can achieve that by using the data we have and with smart tools to keep patients at home for longer. The solution will also improve job satisfaction and avoid burnout of clinical staff, which is seriously depleted right now.
So, these are some of the reasons training people in self-care, self-healing care is so important. Those of us who want to shift what's going on in our hospitals, what's going on in our emergency rooms, what's going on in the kitchens and bedrooms and homes of frontline workers. We need to understand that it's not only going into those systems, being part of it, and therefore changing it from inside, but it's also that we can increase our energetic frequencies and our magnetism to have these services come to our homes, as this article describes, services coming to the homes of people in the UK. So it's just another way of looking at how we're using advanced energy healing to shift the delivery of services, the delivery of health services, and prevention. The concepts of prevention and how prevention is key. Thinking about who you're being right now, the healthiness, the health, your holistic health in the moment. How happy are you? How deeply are you breathing? How comported are you? How composed do you feel? How balanced? How harmonious with what's going on? How much peace are you offering to your life? How much do you see the positive energy in what is occurring that may seem to be a downward spiral, but is actually a way to be an upward spiral for your life? There's many ways to look at this. Just keep looking.